So hi guys, my name is Rolf Kishanalin and today I'll be doing my return demonstration about assisting blood transfusion. So what is blood transfusion? So blood transfusion is a life-saving procedure that could help replace blood loss due to trauma, injury, or an illness. So the first thing you have to do in assisting blood transfusion is you have to check the doctor's order. So you have to check if the order is complete. So here the doctor writes the date, the time, and the type of blood that has to be secured. So the order is to secure and transfuse 1 unit of whole blood of patient's blood type, properly screened and cross-matched, transfused for 4 hours. This is the name of the doctor. So that's the doctor's order. After you check the doctor's order, of course, you have to secure a blood consent form that the patient will consent for blood transfusion. The patient should attach his or her signature that he or she agreed with the transfusion. So after that, the nurse will now process the blood request. We'll be going to fill the information here. And the name of the patient, attending physician, the diagnosis, blood type and the type of request, number of units needed, and the component that needs to be secured. And also the signature of the requesting physician. This blood request form will be sent to the laboratory or the blood bank. Once the blood consent form is already done being processed, the medical technologist will go to the patient's room and get a blood sample. This blood sample will be used for blood typing or for cross-matching. Once everything is done and the blood is already available, it is now time for you to prepare for the next step of blood transfusion. So once the blood is already available, the nurse now will send a request to the blood bank to release the blood inside the blood refrigerator. So the first checking or verification of blood happens in the blood bank. Once the midwife or the nurse gets the blood and the blood reaches the nurse's station, the nurse in charge now together with the charge nurse will do the first verification. So there is a piece of paper here from the blood bank together with the blood bag. So you have to verify that all information written here is correct or aligned with the information written in the blood bag. So together with the charge nurse, you have to check the patient's name, the patient's blood type, the ABO blood group. If it is B+, then it should be B+. So the RH, if positive or negative, then the expiration date, and most of all, the serial number. If everything is correct, then you have to put this in the tray. So next, you also have to check the blood bag if there is any color changes or if there is any leakage. You also have to check the tubings if there is any leakage or any air inside the tubings. If there is none, then you are now ready to bring this blood bag to the patient's bedside. So you prepare now your blood set. So your blood set is different from your macro set or your micro set because the blood set has a blood filter. So you can see this in the portion here. Of course, you also have to prepare the materials for vital signs taking because you have to check the patient's vital signs prior to the transfusion. So you have your stethoscope with you. You also have your clean gloves, your dry cotton balls here. You also have your alcohol swab. You also have the thermometer, and of course your waste receptacle. Then you may now bring this to the patient's bedside. So, may buntag sir, kagwapo ni mo ron sir, eh? So, ako din mong nurse ko ron. Akong pangalan kay si Rolf Kishanalin. Pwede ko makabaw sa imong full name ug sa imong date of birth, sir? Okay, sir. Ako may check, sir, ha? Okay, sir. So, the doctor, sir, has an order for blood transfusion. Are you aware of that? Do you know your blood type?
Yes.
Sir, nakasuway na ba ka nag-blood transfuse before?
No.
Okay, sir. So today, sir, I will be transfusing 1 unit of whole blood with your blood type, which is type O. So right after the transfusion, sir, you inform me if you feel any allergic reactions to blood. Okay, sir? So before the transfusion, you have to check the patient's vital signs. So you have to check the blood pressure, you have to check the temperature, and you also have to check the pulse rate and the breathing pattern of the patient. So may buntag sir, ako dahil si Ralph Christian Alin, ang imong nurse. O kani kay si
Dr. Justin Alin, sir.
And today we're going to do the second verification of your blood transfusion. So okay doc, so patient doc is Ken Edward Anyos.
Okay.
Then blood type doc is type O.
Okay.
The expiry date is November 11, 2021.
Okay.
The serial number is 146779.
Okay.
And the expiry date is May 4. Okay doc?
Okay, clear.
Okay doc, thank you. So after the verification, the nurse will now prepare for blood transfusion and do priming. After verification with the doctor, if the blood is with the correct patient, you should see to it that the patient's IV line plain NSS should be plain NSS only without any medications incorporated in this IV bottle. After ensuring that the patient has an IV line with plain NSS, you have to make sure that the IV site is patent. There are no signs of infiltration or any signs of plebitis. You have to see to it that the gauge being used for the IV cannula is bigger, like gauge 20, gauge 18, or gauge 22. In priming, you have to wear your clean gloves, only clean gloves. This is to protect yourself from the body fluids or blood that will come contact into your skin. Next is you have to open the blood set. So just open this and get the blood set. So this is now your blood set. So you have to check if there is a leakage. Then the first thing you have to do is you have to move the regulator near the filter area. After that, you have to close the regulator. After closing the regulator, you have this opening here. Actually, there are two hoses in this bag, but you just have to choose one. You just hold this and you open. You have to make sure to make this area sterile, and you have to make sure that the blood bag is placed in a flat surface. Then after that, while holding, you have to open the spike. So you have to make sure that you do not touch this area here, and you have to make this sterile. Then you have to insert slowly. Move the spike on a circular direction while pushing the spike downwards. Then after that, you have to hang the IV bag in the IV pole. So you have to press this chamber here until it is half full. Slowly open the regulator to fill the tubings with blood. Once the tubing is already filled with blood, then you close the regulator.